My name is Phil Perazio, and I'm a urologic oncologist, a surgeon. Like many of you, I absolutely love what I do, and I would not choose another profession. But I have struggled with professional identity, practice efficiency, and wellness over the years. Operate with Zen is a podcast designed to explore a mindful approach to surgery and to being a surgeon. By discussing these struggles and mindful solutions, I hope together we can create a community of strong and healthy surgeons. Enjoy. Welcome to this episode of Operate with Zen. This is our season finale, and I'm here with two really good friends and guests, Dr. Angela Smith, Dr. Jay Shah. I will let you introduce each other or yourselves real quick, and then we'll get to the topic at hand. So Angie, why don't you start us off?
Yeah, hi, I'm Angie Smith. I'm a urologic oncologist from University of North Carolina. I do a little bit of research and I also do some faculty development. And I'm just a huge fan of your podcast, Phil. So I'm really excited to be back and talking about some, I think, really critical information that we all face as surgeons one time or another. So thanks for inviting me.
Yeah, Dr. Jay Shah.
Thanks, Phil. Hey, y'all. It's a great pleasure to be here. Phil, Angie, it's so nice to spend time with you. I think every encounter I've ever had with the two of you I've enjoyed, so I look forward to chatting with you on this. I can tell this feels different than any other podcast conversation I've had before. That there's a part of me that feels a little bit more lighthearted. I'm sort of tempted to make some jokes here. Maybe it's because we secured the highly coveted season finale spot. I don't know, but I'm very much looking forward to this conversation. For those on the other end of the podcast who I have not yet met or who are not familiar with me, I am also a urologic oncologist, like my two esteemed colleagues here. I'm at Stanford University, where I've been for 6 years. Most of my career clinically has been focused on taking care of patients with complex bladder cancers who need surgical management. And I also wear some other administrative hats. I'm currently the chief of staff of Stanford Hospital. But we're not here to talk about any of that today.
No, we are not. And I think that's what's really fun about this episode. We are not talking about patients or patient management today. We're going to talk about ourselves. And interestingly, Jay, Angie, and I are all friends, and all three of us have had pretty significant physical ailments in the last few months. And so we're going to talk about our physical kind of trials and tribulations and our physical health and how that impacts how we function as surgeons. And I think this is important to talk about because I think every surgeon is going to experience this at one level or another, if not multiple times in their career. So we'll get right to it. I'll get started kind of with my story, and then we'll kind of go around the room. So as many of you know, I've talked about on the podcast multiple times, I love playing basketball, and basketball was a huge part of my physical well-being and who I was. And in January, about 4 months ago, I shredded my ACL and hurt my knee pretty significantly playing basketball. It led to surgery about a month later. I am now 3 months after that injury, 2 months into rehab, and it has greatly impacted how I feel and function on a daily and weekly basis. But it hasn't really affected too much of what's happened in the operating room. So I think we'll pause there. We'll let everybody kind of weigh in on their personal ailments. So Angie, why don't you go with yours next, and then we'll discuss this and break it down.
Yeah, I have had a sort of a variety of ailments over the years. I think when I was in residency, I had a back problem and had to do physical therapy and some other things so that I wasn't in excruciating pain, even when operating on the robot. I also operated when I was pregnant, and I think that exacerbated things. I think pertinent to this discussion, because Phil, you were talking about how you saw yourself, and I'm sure we'll get in more depth. That I was a runner. I did track and field, cross country, long distance, and it was just my outlet, and that was really important to me. I realized over time I ended up having a meniscal injury on one knee, and it was a pretty serious one. They believe it's like more genetic than it was actually from running, but it needed to be completely removed. And then just a year or two after that, sadly, the other one went the same exact route. They had to completely remove the meniscus there, and I was left with a choice. You can continue running, or you'll need a knee transplant, like, or knee transplant, knee replacement, probably in the next 5 to 8 years. And I'm fairly young, so that was a big wake up call. Or you can re-envision yourself as an athlete or the way you exercise, and that was tough. And then most recently, I had a hip injury, and I'm now in physical therapy for that. And I was rowing as a complement to my running, and so I think it's all about re-envisioning yourself and how we get over some of these humps in the road. So that's my story, at least where it's at right now.
Yeah. Jay, bring us up to where you are.
Yeah, I'm gonna have to be careful not to take up the entire rest of the time here with my litany of injuries. I'll try to keep it brief. I similar to what you both were describing, I've had some sort of acute injuries that I thought were just little bumps in the road. And more recently, I think the reason this topic has been very much on my mind is I've got some things that I realize are not just bumps in the road, but sort of more detours or sort of more redirections of how I have to see myself. I rode crew in high school and college, and I've always thought of myself as very athletic. It's always been important to me to focus on my fitness. And in medical school, I tore my left ACL, my anterior cruciate ligament, need to have surgery for that. And recovered from that, was just fine, went on to do lots of triathlons and marathons and got back to that identity of being an athlete. And more recently, I needed a second surgery a couple of years ago on that knee. And what I've realized is that I've got essentially no meniscus left on that left knee. I've got bone on bone grinding going on in the medial compartment of the left knee. And that's not something that you just sort of rest out. It doesn't go away. So that's one of the things I've had to come to terms with. More recently, within the last year, I've also been diagnosed. You can't see it on a podcast, but I'm holding up my right thumb where I'm wearing a thumb splint. I have carpal metacarpal joint osteoarthritis in the right thumb. And in the last 7 or 8 months, I've started wearing glasses. And most people say, oh, when you get into your mid-40s, you need some readers, etc. But these are not just readers. These are actually for distance vision as well. So at the same time that my presbyopia has kicked in, my distance vision has started to deteriorate. So as a surgeon who saw himself as an athlete, I've sort of now been found to have a couple of chronic things that are not going to go away. I can't see, I can't use my hands, and I can't stand. So you talk about re-envisioning yourself as a surgeon and an athlete. I've had to do some serious soul searching about, wait a minute, how's this going to work going forward? And that's a conversation I look forward to having with the two of you today.
Yeah, so I want to thank both of you for sharing the stories. It's not easy to talk about our weaknesses and where we struggle, but these are all been real for all of us, and they've affected.
Who said weakness?
Yeah, exactly.
I don't think Andrew or I said weakness.
Maybe I'm projecting, but
new superpowers.
Yeah, exactly. And I think it makes you reflect and think about who you are and what your career is going to be and how we're supposed to do this. When we start our surgical careers, we're talking about a 30-year sustainable career. That's the ideal. And these are things that can certainly influence that sustainability. So I want to start right at the beginning. When you first whether you want to call it diagnosis or when you first felt something, I want to talk about your first reaction to feeling this. And I remember mine when I hurt my knee. The first was a lot of explicatives in the basketball court, but on my way home, I remember being really embarrassed, which was kind of a weird feeling. I mean, there's nothing to be embarrassed about. I didn't cause this intentionally. Nobody did this to me. This was a non-contact injury, but I was extremely embarrassed because I felt like it, I like you guys, felt like I was athletic. I was an athlete. I took good care of my body. How could something like this happen to me? And shame and embarrassment were the first feelings I thought. I didn't know if you guys had similar experiences. And Angie, why don't you start us off here?
Yeah, I think I would say mine was a bit different. I think a lot of different emotions can run through your head for a variety of reasons. Mine was actually grief. And I think, and that might be because of the way mine occurred. I think some things occur acutely, some are more chronic, and the way that it's described to you. So for me, my knees and the meniscus issue apparently was a chronic thing that I didn't know about. They even said, like, listen, this is genetic. This is just what you had. And so I had less shame about it and more grief, because they said, listen, you're not a runner anymore. And I had identified myself as such. And as you mentioned, Phil, what, being a surgeon is a physical act. Like, I felt actually that it's very important to keep my physical health. Even when I was pregnant, I was like, I'm going to stay in shape because I know this is going to be a demand on my body, and that was going to serve me well. And the way I did that was running. And so when it was taken away from me, honestly, the first thing I felt was grief, and that was the emotion overwhelmingly. What about you, Jay?
For me, I think one of the defining feelings that I've taken through much of my life has been denial. What I mean by that is, no matter how difficult things get, and maybe this is emblematic of a lot of us surgeons, we have these super developed super egos where you tell me to work 6 shifts overnight in a row, it's going to be horrible, but I'll do it. No matter how difficult something is, we find a way to persevere and just get through it. And I use that same approach to each of my various injuries, where I would know it's there, but I would never consciously speak it into existence. I would just work around it. So when I couldn't run because the knee was hurting too much, I would just do a lot of Pelotoning or a lot of swimming, or just find something else to do. And for a while, I made a game out of it, saying, as you get older, the body's going to keep throwing different things at you. And you can't just say, well, my knees hurt, so I'm just going to sit and do nothing for 3 months. No, because then I'm going to get out of shape. And from a mental health standpoint, I'm going to suffer a lot. So I would just constantly keep ignoring the problem, so to speak, in what I justified as a very functional way. I'll go, yeah, my knee hurts, but look, I'm swimming a lot more right now. And then, my neck's starting to hurt from all the swimming and the breathing. I'll just get a snorkel. Now I'm going to go switch to the bike. There's always something else that we can do to deflect from the problem. So for me, denial is what I've often used. And then more recently, the last couple of years, as I've sort of focused more on just coming to terms with who I am, going through some other difficult things, I realized that I just need to face these things and accept them. You can't repress a lot of these hard things. You have to metabolize them to actually move through them. Because Angie, similar to what you were saying, but when I first found out about the knee stuff, because like I said, I used to run marathons and do triathlons. It was a huge part of how I dealt with the world. After a long case, I would go run my brains out. Or if I knew I had 2 cystectomies back in the day, I would make sure I ran 12, 15 miles, because the adrenaline would get me through that rough day. And I remember flirting with the idea of depression, of, oh my gosh, I'm never going to run again. So I was tempted to go that way, but now I'm trying to be much more sort of just open about it and saying, look, I can't express it as a overt depression. I can't repress it like it's not happening. I think that the best path forward is just to own it, be open about it, not feel any shame or guilt for myself, give other people permission to not feel sad for me, and just say, yeah, this is just who I am. It's just part of life. Everyone gets, we see patients every day that get news they don't want to hear. And we see some that deal with it great, some that deal with it poorly. And so for me, that's sort of where I'm trying to get to.
Yeah, I think super healthy perspective. Angie, I didn't know if you had any thoughts, but I've definitely thought about this process and all. And I think getting to your point, Jay, about seeing other people's experiences and recognizing and trying to give yourself a little bit of grace and say, listen, these things do happen. This is part of life. This is part of a physical existence. If you are going to have a physical existence and be a physical person, you are going to have physical ailments and injuries, and give yourself grace in that. And it took me a little while to kind of settle on that. Angie, I didn't know if you had any thoughts or feelings about it.
Yeah, I agree with you, Phil, and resonated with what you said, Jay. I think that it's okay to allow yourself to grieve a bit, because that was who you were. At the same time, there is a fine line between perseverating on what you wish was, because that's not the reality. And, while you can give yourself grace and you can grieve a bit, there is an element of saying, okay, but this is my reality. It could be worse. And I think that's true for all of us right here talking. There's many things, we see that every day. And so having that realization can get you, I think, across that line to a mindset of openness. And Jay, you were speaking to that, is thinking through, okay, this is an acceptance. This is what I am now. And getting your brain to a point of possibility, right? That maybe what has occurred can give you something you never had, that you never would even explore. And that's what happened to me. I looked that, but I still went through that path. I grieved probably, maybe it was too long, but I always say it probably was the right amount for me. And then I realized what I needed to do next, tried it out, and I had that acceptance. And now I look back and I'm like, I'm really glad I reinvented myself in a few different ways, because it actually works better for my life right now than it did when I was a runner. So I do think that there is that, grieving process, or, whatever you want to call it, that process where you become accepting of your situation to a point where your mind is open to the possibility of what else might be on the horizon for you that is different than it once was. It's an evolution. Our lives are always evolving.
So I want to kind of follow these injuries or physical ailments a little bit chronologically. And one of the things that comes up early on, whether it's an acute or chronic issue, when it comes to light, is how we manage the discomfort, the physical discomfort and pain of that injury. And anti-inflammatories, wraps and braces are all part of it, but it can be a real challenge. So, Jay, why don't we start with you this time? How do you manage some of the physical discomforts of these issues?
Yeah, well, I'm so glad you asked that, Phil, because I have just discovered this whole world of physical therapy. So I had physical therapy for a couple months back in med school after I had my ACL repair. And I went into that mindset of, all right, this is something I got to go through, and then I'm going to be back on the track doing my wind sprints and everything's going to be just fine, because it was a small acute bump in the road. Now with the more chronic issues, I've just come to learn that, without oversharing, I don't use my lower half of my body well at all. Apparently, I have, I don't know, how, is this a PG podcast? I'm about to perhaps change that. Apparently I have pancake ass, is what my physical therapist tells me. I don't know how to activate my glutes. Angie's covering her face right now. You can edit this out or not. But I literally have never used my glutes in my whole life. It's like a new planet. It's uncharted territory. And I have learned over the last couple of weeks that learning how to use them, learning how to stabilize my knee, even with the fact that I have, bone-on-bone issues in there, with a more stable core and more stable support down there, I actually don't have knee pain on my left knee. I'm going to knock on wood right now just to, make sure I don't jinx myself. But I've no longer been using Advil, or what's the stuff you put at the topical stuff you put on your knees. I haven't been needing that, because I've embraced this idea that there are experts out there who know better than I do. I've always just thought, yeah, I went to medical school. Yeah, I dissected a cadaver. I know what the muscles are. I'll just work harder. I'll just go to the gym. I'll just fight through it. And so my approach to managing the pain for me has been listening to other people, to putting my trust that people who do this full time really know what they're doing. And it's working really well for me, because similar to Angie's point earlier, being in my 40s and contemplating the idea of a knee replacement, or as Angie calls it, a knee transplant, like that's not an appealing thought for me. I've not wanted to do that. So I've asked, if I just literally at the age of 46, I'm relearning how to walk, which I don't mean to be melodramatic. I can walk just fine, but you know what I mean? That I'm learning the mechanics of walking in a whole different way. And that for me is proving to be, from a pain management standpoint, really fantastic.
Yeah, Jay, it's a great point. I just want to comment on two quick things. I had the good fortune a couple of years ago of somebody noticing that I wasn't using my hamstrings and ass muscles as much as I should be. So I actually think that's helped me a lot come through this knee injury, that I've been focused on those for the last couple of years as core stabilizers. And one of my favorite Peloton instructors always says, if you don't squeeze your butt, nobody else is going to squeeze it for you. So it's always something you got to work on.
But we'll find you somebody, Phil. Don't worry.
Yeah. The other part of this is relying on others' expertise in this field. And we all bring in our preconceptions of what we think should happen medically to us as we go through these things. And for instance, this is a silly one, but I didn't believe that much in icing. I liked compression, but I didn't believe that much in icing. And so not only did my surgeon, but the physical therapist were like, ice, 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 ice. And then, being the kind of skeptical mind I am, I started icing, but I also started reading into it. And you find the local tissue benefits of ice in that area actually translate, at least in some preclinical models, into systemic benefits of ice in that area and helping healing. So it helped me kind of lose some of my dogmatic thinking, relying on the experts.
Yeah, and if I could also comment and layer on to what Jay mentioned, I couldn't, right now I'm going through the same thing. My issue is core, but glutes are part of your core theoretically. And I don't use the lower core, and that was my issue. And it's interesting because the physical therapist teaches you. In fact, I've now graduated to 7 months old, because there are certain movements infants do that engage the core that we lose over time. And so very much resonated with what you said. And I'll layer on a couple things. The first is that sometimes you do need NSAIDs acutely to lower the inflammation to a point at which you can engage in these activities. So I think the key is I think it's helpful to use some adjunct for a bit, but don't rely solely on it. Always, have the expertise. Then you have to actually engage and do it. That's the other thing. I was thinking about that last night as I'm doing my core exercise, my 7-month-old rollovers with the stability ball. But you have to do it consistently. And that can be hard too, because we're busy. And I think the third piece of it is we don't allow ourselves to rest. I remember back when I had my meniscus removed, and that's why I said transplant, because I was so young when I got my meniscus removed. They offered me a meniscus transplant, which is a thing. And the reason I didn't accept it and I decided not to do it is because I have to be actually off my feet for at least 6 weeks, probably they said more like 3 months. And I was like, as a surgeon, I'm not gonna do that. I decided, I was like, you know what? I just will live my life in such a way that I have bone on bone, but I'm gonna really be very careful with my knees from now on. And I just bike and row and so forth. But I made a conscious choice. But the thing I remember is that when I had the meniscus removed, I actually had clinic 2 days later on my feet. And I shouldn't have done that. I was swollen and I hurt and I was and so we don't give ourselves the rest that we really should be giving ourselves. And so we can set ourselves up for, success or failure based upon the amount of grace we give ourselves to actually recover in a way that sets us up for the next step, which is physical therapy. So I would just layer those before and afters too, which are within our control. And we often are our own worst enemies as surgeons, I would say.
Yeah, I found a couple of things helpful. I worked basically the entire time. I took a week off immediately after ACL surgery, and it was I needed at least a week off. I mean, that was a tough operation. And for those of you, both of you had meniscus injuries too. I mean, though my meniscus was trashed, and that hurts a lot. Coming back to the OR, things that helped, obviously anti-inflammatories. I liked layering the long and short acting. So it'd take, you could take 2 Aleve, and that'll give you a good 12 hours of coverage. You can add Tylenol on top of that for any acute breakthroughs. I thought braces were very helpful just by helping with stability, because a lot of the pain comes with instability in any joint. So braces helped. And I also found the ergonomic pads extremely helpful by just taking pressure off things. So the nursing and OR teams were phenomenal in helping with pads and things around the operating room. And to your point, Angie, I tried to take micro breaks. It was hard, give myself time off my feet, get my feet and legs up in the air when I could. But I'll tell you realistically, the only real breaks came on the weekends when I could just get my feet up, and my wife and kids were great about finding things to do with me while daddy just sat on the couch and kind of recovered. But I mean, that was the truth. I mean, we have busy lives. There are people who do rely on us being in the operating room. And I wish I could say, yep, I gave myself 3 months off from work, but the reality is a lot of us just can't do that. And finding a way to make it work in a safe way that allows you to recover, I think, is really important.
I think to that point, to amplify a little bit, I think the same things that we're talking about, those pressures that make us go back to clinic or the OR a couple days after these major operations, where on a multiple choice exam, we would know the right answer. We'd know, oh, yeah, you probably shouldn't go back to doing that. And Angie, I was equally guilty after my last meniscus surgery 5-6 years ago. I did an 8-hour case in the OR 3 days later. And I knew it was stupid before I did it. And it was stupid while I was doing it. And it was stupid after. But I did it anyway, because I don't know if it's because of the stories that I tell myself or that we tell ourselves about what we need to do and what people expect of us. I wonder what contribution those mindsets have towards getting us in those situations that cause the injuries in the first place. I wonder, we all admitted to sort of, at least I think maybe I was the one that admitted to ignoring my injuries for a long time. Yeah, I think it was just me. But I wonder how many other colleagues of ours are out there also feeling some of the same pressures. Because, we all feel this pressure to produce. You've got to be busy. We always juggle about 3 more balls than we can comfortably juggle. And one of the things that we really are very quick to put aside is our own needs, our own physical needs, or our mental health needs, or the needs of our friends and family, etc. I wonder how prevalent this is out there.
Yeah,
I
I think
wonder
it's
that too. And I even wonder how the pandemic has started to shift our viewpoint with podcasts like this one on the importance of putting our needs first and the importance of unraveling the stories that we tell ourselves in the culture of medicine that can be translated in a number of ways, like how many hours you work, do you work weekends, like who are you prioritizing and when and why. It's all, to me, it's all the same story. It's just in a different scenario. And I do wonder how this is an opportunity right now to shift the mindset, especially because it was the first time that we were required to be off work. If you got COVID, you're not coming to work. You'd be penalized to do so, right? And that shifted something, I think, in all of us that may have also shifted the way we think of self-care in general. And I think that's a good thing.
Yeah, I think it's a great thing. But how many of us still now get colds and go back into work wearing a mask, right? I mean, that happens too. I think just 2 other things I'd like to bring on before potentially moving on to the next topic. But if you guys have more ideas, obviously chime in. I think one thing my surgeon did very astutely was he said, listen, I know you're going back to work. No matter what I say, you're going back to work. So he kind of worked with me to say, all right, at least a week. And here's kind of some of the things you can do to safely go back to work. And this is what you can expect at the end of the week if you work. And so he was very clear with me and understood that. And I thought that was really fair. And I actually really appreciated that. And I think one of the things, Jay, that gets us into trouble, this is to your point, is kind of these secondary benefits we get from our exercise and our physical activity. And I think sometimes that's what leads to sometimes these injuries, right? Even though your legs, for instance, my legs might be tired or I didn't feel great, but I wanted to go to basketball because I knew there was a chance to connect with 15 of my friends and blow off some steam. And there were other benefits in addition to just physically how my legs or back felt. So there's other reasons to do that. But to your point, Angie, this is the story we tell ourselves. This is why we go back to work within a week because, oh, I'm stir crazy at home. I can exercise my mind at least, and I can do some good for society instead of just sitting around and watching Netflix, where I'm not sure that secondary benefit is actually true.
Yeah, I do think that our minds have a really interesting way of concocting logic where logic does not necessarily exist. And until it's written down on a piece of paper, you really can't outsmart your own brain when you're trying to find reasons to justify what you're doing.
And I will tell you, the both of you, and I'd love to hear your input on this. This is something I think about now a lot in my position of leadership, and you guys have kind of climbed that ladder up even a little bit further, is how do we honor and allow these things? And how do we incentivize, if incentivize is the right word, our surgeons and our physicians to stay home and take care of themselves, right? for instance, I mean, we're measured on RVUs and how many RVUs we produce. Can we say to someone, you've had a major injury, you had a death in the family, you had something traumatic go on, here's 1,000 RVUs, right? Is this something we can do institutionally to support wellness and tell people it's okay to take care of yourselves? And I don't have the answer to this yet. I'm just kind of spitballing, but this is something that I've been pondering since going through my own, injury here.
Angie's waiting for me to speak, and I'm waiting for Angie to speak. But, yeah, Phil, I think I also don't have an answer to your question. I think it's a really valid question. One thing that I think, once we are in visible positions that we have, positions of responsibility like we have, I think one thing that I've been trying to be very intentional about is modeling what I want to see in others. So I've had to have a lot of conversations with myself saying, you need to drop this need to be perfect, or to make sure the world sees you as perfect. Because I think I've realized the world does not see me as perfect. But if I can own my imperfections, if I can be vulnerable and honest about my own struggles, which, you and I have had other conversations on your podcast about these things. Angie, you and I have spoken offline about some of these things. I think the more that we can show that we're not busy looking perfect, that we own these struggles that we have, I think the more permission that we give to those of us, to those out there that are watching or listening to us. Because to you, to me, we just think, oh, this is a decision that only affects me. But I think once you're in positions of leadership, there's always people watching and deciding what is our value system in this particular group, whatever that group is. So I no longer hide my physical injuries. Certainly, I don't even hide some of the other personal struggles outside of work that I have, etc., because I know that everyone else also has their own struggles. And if I don't own my own struggles, people are going to feel uncomfortable opening up to me about their struggles, or they're going to feel uncomfortable opening up to other people. So one of the phrases that I've been playing with in my head a lot is leading from the wisdom of my own brokenness, and making it okay for other people to feel broken, not to live in your brokenness forever, but to acknowledge when it's there and say, hey, look, here's what I'm metabolizing right now. I fully expect to learn how to thrive in this difficult thing, and I will thrive. And whatever it is that you're going through, whether it's a physical injury or something else, you too can learn to thrive, but only if you talk about it, only if you own it, only if you reach out for help if you need it. So that's sort of where my head is. Again, I don't have a policy answer to your question about how do we actually make it so we can say, here's 1,000 RVUs for this difficult thing. We expect that your productivity will drop. I think none of the three of us are in positions where we get to dispense RVUs. So it's not a decision we have to make, but I think it is a question worth asking and a conversation worth having.
I was hoping Jay would have the answer. That's why I like to go first, Jay. But I agree completely. Modeling is number one. But and I think the other thing to consider is, what would a policy like that look like? I mean, in the end, healthcare is a business, so you can't discount the RVUs do matter, right? The productivity does matter. I mean, to say otherwise is not true. That being said, a lot of the things that are discounted in businesses is the happiness of their employees. Do the employees thrive? Because if they do, as a matter of fact, you do get that back on the back end. And here's what I mean: it's just harder to model, but not impossible. One way to model that is the retention of your employees. And so you could look, at how many of your employees choose to leave versus come. And we know, there's all these numbers that are thrown around. It costs $3 million to replace one surgeon who leaves just to get another one in that place, because it's such a costly endeavor. And so if you start modeling that in the long term, if you do have policies in place that actually emphasize the self-care of these individuals, allowing them to thrive, promoting them from within, allowing them to be fulfilled at your institution, you may actually have a return on investment that you may have discounted initially because it's not the RVU at that moment. And that is hard for healthcare to do. I think a lot of organizations, I'm not in a position to do that. But when I look at it, I'm like, there's a lot of long-term things that are discounted for the short-term buyers. And these are the RVU things. So in ideal state, I think that would hopefully be something that would be considered. And but do I have the exact answer? No, but I feel like it has to move in that direction with that vision in mind.
Yeah. Jay, go ahead.
Yeah, I have a comment. This will probably get me some nasty texts once this episode hits, because I think what I'm about to say might be a little bit unpopular. I think one of the other factors beyond just this expectation of, oh, my department chair expects me to do this, or I need the RVUs. I think some of us also have this mindset of only I can do this. Like there's this hero complex of, well, I must do this. In my world, I must do this cystectomy because who else is going to do it, etc. And I think we need to get over ourselves a bit. And seriously, I mean, I know what we do is valuable, and I don't mean to demean it with my comment, but that notion of, well, if I don't do it, no one else will. There's hardly a human being alive that I think that could apply to, where someone else couldn't step in to do that thing. So I think I say that, and I should probably phrase it in a different way to give people permission to give up some of those things, as opposed to sounding judgmental, which is how it might have come across. But I think just to know that no matter how unique your skill set feels, there are other people who can do it. And I forget which of you said this before, just to give yourself permission, saying, yes, I do this. Yes, people come from all over the state or all over the country or all over the world for me to do this. And even if I get abducted by aliens tomorrow, that service I provide will not disappear from the face of the planet. It will happen somehow. And right now, what's important is that I make sure I can provide that service for the next 20 years, as opposed to grinding through now for a couple more weeks or a couple more months, and then hitting a wall when I have a major injury.
Yeah, Jay, that's a great point. And I will, in full honesty, I struggled this. I think we all struggled this. Every junior faculty member does at one point, where you kind of have that complex. I'm the only one who can do this, until you realize you're not. And one of the exercises I like to do with faculty when I see them kind of struggling with that, we bring up kidney cancer, because it's just easy to say, all right, 80,000 kidney cancers per year in the US. Do the math. How many days are there in a year? 365. All right, pull out your calculator. 80,000 divided by 365. You couldn't do that many kidney surgeries per day if you wanted to. And there are other people out there who do them really well also. So it's okay, to your point about that. And then I just want to touch on this RVU topic again real quick, and then you guys feel free to comment, but I really want to get into identity also. But what we all want is, we want the hospital to say, yeah, we recognize that this is not a sprint, it's a marathon, and 1,000 RVUs this year count for nothing in the length of your career. So let's just compensate you for them. We'll be waiting a long time if we want our hospital administration to do that, but we can look the same way ourselves and recognize, you know what? My productivity is going to take a hit. I may not make my high productivity bonus this year, but I'm going to have a much better year. I'm going to have a much better recovery and a much better career if I give myself that grace. Now, that's a little bit harder because we're dealing with tuitions and car payments and other things, but that is one way to kind of reframe or rethink about what those 1,000 RVUs mean. All right, so on kind of the next topic I wanted to bring up with you guys specifically, we've talked about our first reactions. We've talked about managing pain. Now let's get into that identity question that we've all been kind of beating around the bush a little bit at. Jay, tell us, how has this changed your identity? Who are you now as compared to who you were?
Yeah, so to go through the full cycle of it, when I was first starting to grapple with these things, I was struggling with, well, if I'm not this extremely athletic surgeon, who am I? What will I be? This is what the world thinks I am. This is what I need to project. And I realize now, none of that is true. I think I am actually, from an identity standpoint, more able to relate to my patients. And I'm not saying I have bladder cancer. Obviously, the disease that they deal with is different than the injuries that I'm coping with. But just that understanding of how small things that the world doesn't see about you can really impact your day-to-day. For example, if my thumb is hurting on any particular day, no one sees that. there's not a big, throbbing mass that they can say, oh my gosh, is your thumb okay today? I tell people, some people see the splint, they think it's just for what's that thing called here?
Carpal tunnel.
Yeah,
Oh.
that's it. That's thanks.
Either that or archery. I didn't know what you were doing for.
Yeah, most people think it's just for carpal tunnel, but no one, after the initial, oh yeah, I've got a arthritis thing, no one thinks to ask you every day, is your thumb hurting today? Is it hurting? Did you write too much yesterday in clinic and your thumb hurts today? People don't think about it at all. People don't sort of notice it. And I realized I was probably doing the same thing all the time with my patients, where these things that are becoming a huge part of their identity, it becomes, especially for cancer patients, it becomes a life-defining event for them. And I think I was probably fairly insensitive to that because I was a world expert and I'd see them and I'd say, oh yeah, you have stage this, grade that. Here are the options, A, B, C, D, E. Here's the best thing for you. You're at a good place. We're going to get you the best care possible. And I was so focused on staying in that channel of managing the disease that I probably wasn't taking time to see the person and the values and beliefs that underlie that whole other discussion. So I think now, having struggled through some of these things myself, I am much more attuned to that level. And sometimes patients will make a decision that is absolutely not at all part of the guidelines as far as the best thing for that particular stage, grade, ICD-9, whatever. And yet I'm okay with that because I can understand that in their greater context, it's part of their identity. So for me, I take my injuries and I've incorporated them into my identity as a more mature surgeon, as someone who's able to provide a deeper level of conversation for my patients than I probably was able to earlier in my career. And that other idea of, oh, the world sees me as someone who's athletic. Literally every single AUA that I went to for the first 10, 15 years, there were 4 or 5 people that I pretty much always saw at the gym, at whichever hotel I was staying at, usually the headquarters hotel. And if I didn't see them or they didn't see me, they would always be like, hey, what happened? You sleeping in these days? We were sort of the morning crew. So there were times where, I would overdo it, would stay up too late. Like, no, I got to get to the gym because I'm going to see Ed Messing. And he's going to say, oh, you're not going to the gym today, huh? Or I'd see Matt Golsky and he'd say the same thing. But I realized the world is so much more forgiving and understanding of who we are that I don't feel like my identity has changed to the world at all in that regard.
Jay, I love that your identity perspective is about empathy with your patient and becoming a better surgeon. And I was thinking about, Phil, what you said as well, how your surgeon recognized that, said, hey, I know you're going to go back to work, so let's work on a plan that works within that framework. Understanding that, is it the guidelines? No, you're supposed to be really off your feet for this amount of time, but you really want to go back to work at this. So how can you get that person there and listen to them while also being cognizant of like getting them the self-care they need? So I really love that identity shift. Phil, when you asked the question about identity, I didn't think about that in particular, but I can relate to it. What I was thinking about is how I defined myself, because I really remember the moment I wake up. Everyone says you don't remember right when you wake up from surgery, but I really did. I remember waking up and the surgeon came by and he was like, you really can't run anymore. And I remember saying, I'm like, but I'm a runner. Like, that was my identity. I said that. And he was like, yeah, you were perseverating. I think I said it a lot. I'm sure that was the anesthetic, but I actually remember it. And it was because it was an identity to me. I'm a runner. Like, if I'm not running, what am I doing? And there was like this, that's why I say it was grief, because if I'm not that, then what am I? And I have since shifted my identity to something that is more broad-based, because that's such a specific thing that it could be taken away, right? So now, rather than be I am a runner, I really more think of myself as a person who takes care of my body. I would never have done yoga had this not happened to me, right? I just wouldn't have. I wasn't into yoga. I just had no, but then I was realizing, oh, I need to strengthen things. I need to stretch. And then I started doing it. I'm like, oh my gosh, I feel so good doing this. And as I get older, and now I understand the benefits. So now I can more fluidly shift. Like I got a rower because I enjoy rowing, but I just had an injury. And I was sad. I had a moment where I was sad about it, and that's okay. But then I was able to shift much more quickly than I was the first time. And I said, you know what? That's okay. I'm going to go to physical therapy, which I'm undergoing right now, strengthening my core. And that's good because why? My identity is I'm a person who takes care of my body. That is my identity now. And that will hopefully go through until I am no longer of this world. So I feel like sometimes when you create an identity, thinking through intentionally what you want to be, that no one can take that away from you. I can take care of my body in any whatever throws at me. I can still do that. That's in my control. So I think that was where my brain went when you asked that question, Phil.
Yeah. Go ahead, Jay.
Yeah, Angie, what you remind me of with that shift, one of the things that I've been using to reframe a lot of these challenges is, and I'm about to get a little bit nerdy on you, but I played a lot of video games when I was a kid. Mm-hmm. And I'm sure you remember like Super Mario Brothers, for example, basic video game. You go through the different stage, you rescue the princess or jump on the flagpole at the end or whatever. And with most of those games, what happened is if you beat the level, you just had another level where now the turtles could fly or they throw fireballs at you, or you had less time to do it. But there would be more challenges to overcome to try to accomplish the same goal. But that's considered leveling up. Like, oh, I made it to level 7. Oh, now Tyson hits harder, whatever the game was. And I just see these injuries as leveling up. Yes, when I had all my joints just fine, I could do the things that I wanted to do that were important. I could contribute to the world in the ways I wanted to. Now that I'm down the medial part of one knee and then the right thumb is a little hurting, can I still find a way to contribute meaningfully? Can I, now in this harder level, can I still be successful? Because in 2 years or 3 years or 5 years or 2 decades, there's going to be another level up. We're going to keep leveling up. And you can just give up and say, forget this. I'm not playing this game anymore. Or you can say, all right, now how do I still succeed? What does success look like on this level?
That's awesome, Jay. I've taken a slightly different thought process on it, and I've considered mine kind of an evolution. And I'll get to exactly what I mean by that. But I look back early in my life. Baseball was my sport, right? I played baseball in college, and that was my identity. I was a baseball player, right? And I'm nowhere near a baseball player anymore. I haven't done that in 2 decades, right? And basketball became a part of my life, and then I had this injury, and I kind of had a slap yourself in the head moment, right? And if I think about my identity kind of prior to this injury, say, all right, I'm a dad, I'm a surgeon, and I play basketball, I do yoga and mindfulness. That's like who I am. And then I had this injury, and I go, oh man, basketball's out, right? This is not who I am. And it made me realizing, here's a slap your head moment. What was the first thing I said? The first thing I said was I'm a dad. And what my identity would really upset me was that I couldn't play with my kids on the weekend and do all of the things we'd enjoy doing on the weekend because we're pretty physical, whether it was going out and, taking them for ski or snowboard lessons, ice skating, running around, taking them to gym to be with me to play basketball. So it had nothing to do with me playing basketball. It had all to do with me being active with my kids. And I realized that was a really important part of my identity, not so much the basketball. And so it's made me realize, all right, it was baseball. Now it's basketball. What's the next evolution going to be for me? Where am I going to be in 10, 15 years from now? And how am I going to get there? And so that's been kind of my thought process through this and how my identity has either changed or become more solidified.
Yeah, what I like about what you said, Phil, is essentially you are just aware of why it mattered to you. And we often aren't aware of that, but I heard in what you were saying, Jay, is like you ran after cases was a stress reliever, right? Phil, you did basketball because it was a way to get closer to your kids, but we aren't always aware of why we do what we do and what it gives us. But that was critical to me as well, to understand like, okay, I'm a person who takes care of my body. That was what it was. I realized it because when it was taken away with the meniscus surgery, I stopped exercising. I did have a moment where I was like, well, what am I going to do? I can't run. And I only when it was taken away did I realize what it was giving me, because I wouldn't say I was depressed, but I wasn't Angie. I mean, everyone who knows me, I'm like an upbeat person. I mean, probably annoyingly so. And I'm sorry for those who know me. But that's just who I am. And I really enjoy being that person. But I wasn't after I was not running. And I realized, oh, I see, doing some kind of activity gives me my energy. Okay, now I know that. So I'm going to do something to take care of my body so that, and my mind, right? So that I can get that back. But it was only till I lost it that I realized what it was giving me. And then you just find a substitute that can give you the same result. It's just a different way. It's that open mindset that you're like, oh, here's the other possibility. This isn't the only path to, getting that energy out. There's lots of other paths. And you have to get there, though, to believe that there is something else that could be just as good, maybe better, right? And for me, it was the Peloton. I was like, I'll never get a Peloton, but look at me now. I have like a room full of Peloton that is not treadmill based. And I love it because it fits with my schedule. I can do it when the girls are asleep. And I could be a mom and still, be here at home. And so you never know what's around the corner, but having the awareness is, I think, critical because that gives you the mindset of knowing what the next solution is.
I just want to point out to the audience too, you are listening to 3 experienced coaches who coach people and are also tuned in to what each other's saying. And these are some coaching skills you're hearing coming on too. So I just wanted to make that brief kind of side comment here. But Angie, it's an awesome segue. And I want to talk about how your physical well-being has evolved. Meaning, how did your workouts change? How did you take care of your body differently before and after? Then we'll go on to Jay and I'll give my story too.
Yeah, I love that question because it is an evolution and it still remains so. I will say that even though I was a runner, I wasn't very consistent about doing that my whole life. I mean, I was that kind of person, like I could just say, okay, I'm going to run a half marathon. No big deal, and then I would train for it. It's not like I could do it the next day, but I trained for it and then I do it. And then I'm like, okay, I'm not going to run for a while. And then maybe I'll run again. But I was very inconsistent about it. And I didn't appreciate what consistency could provide me. So that was the first evolution, is understanding that, and the pain of like getting back into it each time. If you're going to run a marathon or something, there's a pain point, right? When you're not actually fit, when you're starting. But then after, the meniscus surgery and I could not run, and I had that period of time that I was actually, it's such a like an aha, I think you said slap in the forehead type of moment. I was like, what's wrong with me? I mean, for weeks, for months, I was like, what's wrong with me? And I was like, oh, right. That's what running gave me. Okay, got it. But I think that the next evolution was the possibility of like, what could I be? And I was like totally against biking. I was like, there's no way. And they were like, this is the way. You should do biking. It's better for your joint. It's okay if you have bone on bone because you won't hurt it. And then I was like, okay, well, what's the harm? I think I always think like, in administrative speak, and I don't know if Jay, this resonates, like, if you're trying to get something through, people love the word pilot, right? Because it's not permanent. I knew I'd get a laugh out of Jay for this, and probably Phil too. But just call it a pilot because it's not permanent, right? It's just the possibility that you can always get back to whatever it was you were doing before. And that was a good evolution for me because I was like, I'm going to do a pilot of biking and I'm probably going to hate it and I won't be a biker and whatnot. But you know what? I did that and I love it. I love it. I'm great. I love biking. I actually bike outside now with my kids. And so I think giving yourself the freedom to experiment is some of the fun of it. Even though it's an injury, you would never experiment with some of these things if you didn't have it. And so that is how I've like evolved. And then the last piece is, I said that, and it's sort of a cycle. I'm going back to consistency. It's being consistent with what you do. So whatever it's new, I'm going to do it every day. So I like to say, Jay, I think Jay and Phil, I think I've said this before, I'm a big fan of like really tiny habits, like the Atomic Habits book. So my rule is I just do 5 minutes a day. That's it. So even if I have an injury, I could stretch for 5 minutes. Even if anything happened, I can do something for 5 minutes. But the fact of the matter is, once I do the 5, I'm usually going to do 30, 45, 60 minutes, whatever. Because it's all about getting on the bike, or it's all about, getting on the rower or starting your yoga session, whatever. So I think for me, that has been the key to creating, the framework for actually consistently exercising and taking care of my body.
Jay, how have your workouts shifted?
Yeah, well, For me, I've always enjoyed physical activity. And I'm a morning person, which has been very convenient as a surgeon. So I've generally, my whole life, done things that are easy to do or fun for me to do. So when I was doing tries in marathons, that was running or swimming, biking, etc. And then if I was at the gym in terms of strength training, I would always do pecs and buys and delts, sort of the beach muscles, if I'm being completely honest, because that's what you see in the mirror. That's what people see, and that was fine when I was healthy. That was just fine. And what I've noticed in terms of my evolution, what I've had to do is shift with the physical therapy and strengthening from the core to the floor, is do things I don't necessarily inherently enjoy in and of themselves. I don't love lifting legs. I know most people always say like, oh, nobody lifts legs, but I never enjoyed it. So I really never did it. And I always said, I'm skinny, I'm fine. I don't need to lift legs. I don't need to lift legs. So the main evolution for me has been that I have to do things that I wouldn't necessarily say, oh, I have 20 minutes free. I know, let me go bang out some hamstring raises or some glute sideways, contraption thing that my PT wants me to do. So the evolution has been much more focused on I'm doing this with a purpose. I'm not just doing it because it's fun. It's not play for me to do it. And Angie, I do exactly what you mentioned. There's a lot of times where if it's super early and I know I have an early day starting with meetings at 6:30 or 7, and I'm not an afternoon or evening workout type person anymore. So if I don't do it in the morning, it's not going to happen. And usually what I'll do is I'll say, you know what? I'll just get on the pillow and do a 15-minute ride or a 30-minute, 20-minute, 30-minute ride. And that never actually happened. What ended up happening, as soon as I sit on there and I'm picking through the classes, I am not capable of picking a button that's less than 45 minutes. It's just that sort of drive, competitive, like, no, you have the time, go ahead, do it. So, but I get myself on there by saying, oh, I'm just going to do a little bit to your tiny habits point. But to the overall question, Phil, for me, it's more remembering what the purpose of the strength training is. And it's not just, oh, let me go play at the gym for a little bit. Let me go bang out, see how many pull-ups I can do today and see who noticed and see if I can flex in front of the mirror. Like all that is in the past for me. Now it's muscles that no one usually sees, but that I know that long term will help me recover and sort of keep the joints that I have for decades.
Yeah. And my story is a little bit different. And that's why I love the contrast of these. So, I had the knee injury, and for me, I'm the same way. Morning workouts, it's kind of got to be done. That is part of my identity. I think now is just kind of as I start my day, it helps me start the day with a focus on physical well-being and well-being in general. And we can talk about kind of components of physical health and how we do those. But basically, long story short, my workout before was every day I did yoga. Twice a week I played basketball, and on the weekends I would kind of do some additional cardio and strength training. And then all of a sudden, I can't do anything with my lower extremities. I mean, I'm out, right? Couldn't do yoga, couldn't do anything cardio, basically. I couldn't get on a bike, couldn't get on a treadmill. So now what can I do? And I said, all right, well, I'm going to work really hard on my abs and my core, and I'm going to do a lot of upper body strength training because you know what? It's something I can do, and I'm going to focus on that. And, I joke a little bit. I should have been paying attention. Once again, another slaphead moment. My wife loves kind of the Vikings shows and the other thing with these guys who are huge and jacked. And I kind of was getting into this yoga body, and I'm like, you know what? I need to start picking up some more weights and start working on these upper body shoulders and pecs and see if I can look more Viking-like. But
she loves it for the storyline, Phil. What are you talking about?
It's totally the storyline.
I know now. I know why we're on video.
Yeah, exactly.
Showing off here, Phil.
I need more face tattoos and some long hair, and I get jacked. It'll be great. But it made me realize that I was missing some key components, I think, of my physical health. And it made me realize, first of all, I actually do really enjoy strength training with weights. Second of all, it gave me something that I was lacking, I think, in my prior workouts, where you get some strength training with yoga, but I needed more of it. And it's made me realize as I come back from this injury and I'm starting to think about yoga again, I can finally put my knee on the ground. I'm finally getting enough flexibility where I can think about those things, that I'm not going to be an everyday yoga person. I'm still probably do it at least 3 days a week. I will mix in strength training. And on the days I do strength or cardio, if I get an extra workout in or an extra 20 minutes at the end of the day or whatever it is, maybe I'll squeeze in the yoga class before I go to bed, something like that. But it's made me realize that there are other key components of physical well-being that I was lacking and that I needed to inject into my life. So I'm starting to think of this as, a good wake-up call that I needed to put additional components into my physical well-being. And hopefully this is helping me get there.
Yeah, I like it. It's almost like a well-balanced diet, but it's just a well-balanced physical exercise type of regimen. And I've evolved to that as well. I have just a couple 2 to 3 cardio days that I do some strength that I alternate, and then I have 2 or 3 stretching days, because having that alternating, I think when we are trying to, because we talked a lot about like what do we do with all these injuries, but also how do we prevent the injuries in the first place? Well, it is the well-balanced diet, a physical exercise. Some of it's genetic, yes, like there's certain things that you may be predisposed to, but I know now, and I think you probably both would attest, that when you are well balanced in the amount of exercise you do, core, glute, like whatever you're doing that you were lacking, that strengthens you. And first thing, what did the physical therapist say after my knee surgery? They're like, you need to make sure the muscles around that joint are healthier. And we should be doing that with our entire body, right? We should be able to stretch. We should be able to have good muscle tone wherever, because that's going to support us as we grow older, hopefully. So I think that's a really good comment, Phil. And it's definitely very true for me in the way that I've re-envisioned exercise.
Yeah, I'll tell you, I've gotten a little more body aware through the years. And part of my routine now, Angie, is, I journal, but before I go to bed at night, what I actually do, I love Peloton too. I pick up my Peloton app before I pick up my journal, and I say, okay, this is what I'm feeling today. This is what I'm going to need in the morning. And I pick out, and I know, all right, I'm operating tomorrow, so it's only 30 minutes and 10 of it's always mindfulness. So I'm going to do 10 minutes of core versus 10 minutes of upper body. Well, now that I'm cleared a little on my leg, all right, maybe I'm just going to do 20 minutes full body workout and this. And so every night I kind of assess, all right, this is how I'm feeling. This is what I think I'm going to need in the morning. And then I execute in the morning. And that's become part of my routine a little bit. Jay, go ahead.
Yeah, can I ask you both a question? I think we're having a really healthy conversation about how to handle these things productively and positively. I'm curious to know, what have you seen? Like, I want to go at the other end of the spectrum. I think it's possible where people may fall into victimhood with an injury, a physical injury, any kind of injury. And what have you seen, or what do you worry about in terms of what's the worst case scenario for how this could play out for people?
I mean, I'm thinking actually when you asked, I think it's a great question, Jay. And everyone's going to have a different answer what they've observed. I'm actually thinking of a family member years ago who was just an absolute, you would see him and he was like the athlete. He could do anything. He was like a rock climber, just incredibly athletic. And he had a neck injury. I think he was I think it was actually a car accident. He's older and he's since passed away. But that injury defined the rest of his life. Never did we go to something without it being the core of what was discussed. It was always brought back of what he could not do. It was always framed in that way. And I think that's, to me, the biggest danger is if you stay there. It's totally okay to be there for a little bit, because again, you have to I think there is some element of the process, right? But if you get stuck, that's the danger, because your mind never opens up possibilities of who you could be and what could be possible. And when you get stuck and you don't get into that space, the rest of your life is defined by the injury rather than it being actually created from the injury. And that's what I have learned personally is, I look now at my life, I'm like, I actually really love my physical exercise regimen. I would never have created it had I not had the knee surgery. Truly, I don't think I would have. I would have just been running and, not being very consistent, but doing it. And so I'm in many ways grateful, but I think that's the danger. What do you think, Phil?
Yeah, I think that's a great point, Angie. I think it gets to that identity question. We've all talked about ways that we've been able to reflect on our identity and come out with healthy perspectives. I think the two scenarios I've seen challenging is the one you describe, Angie, where somebody's identity becomes about this injury, about this problem, instead of about the solution and about what has progressed from it. And that's a real thing. And we see that with our cancer patients too, right? We're all cancer surgeons. There are patients who are defined by their cancers in good ways, and there are patients who are defined by their cancers in terrible ways. And it's kind of that survivorship mentality. What direction do you want to take that survivorship in? And I'll just give another the other one I've seen, Jay, where it goes bad is where the chronic injury or the chronic injury turns into something devastating, right? Where somebody keeps pushing and pushing and pushing despite being told, no, you need to modify, you need to make changes. And then it becomes something where they don't have a choice. It affects their identity and who they are, because now all of a sudden they're debilitated in one way or another.
Mm-hmm. Phil, when I agree with everything both of you said, and the reason I was thinking about that question is that, when you were asking earlier about, tell me about using ibuprofen, baclofen, braces, sleeves, I suspect some of the more common things that get used along with those are the narcotics, are the alcohol, are sort of other maladaptive ways that, as surgeons, we are such control freaks that we probably all have colleagues that we have seen resort to these things that in addition to living in victimhood of this happened to me, of just saying, and therefore I'm going to decompensate. Not that they see it as they're decompensating, and it's such a tragic journey. We can probably all think of people at some point in our careers that we've seen do that. And the reason I want to call it out right now is that if I could go back 20 years in my own life, there are people that I saw as senior mentors or people that were sort of too way above me for me to say anything. But I look back and I realize, man, what they were doing was not productive. And I wish that either I had had enough maturity or that someone else had recognized the potential for what was happening as this person was slowly kind of diverging off their trajectory that they had intended for themselves, and were blind to it. Because in the moment, as we're struggling with that shame that you were talking about, Phil, that grief that you were talking about, Angie, I think a lot of people in that moment have a really hard time seeing themselves. And we probably also, I think, are guilty of not being able to see ourselves fully. I'd like to think that we are surrounded by enough colleagues who care about us and love us that they might say something. I would certainly say something to the two of you, and I trust that both of you and plenty of other people in my life would say something to me too. But I think for a lot of our listeners, where they may see someone who's had it may have started as a physical injury, but then has become an identity defining sort of crutch, no pun intended, that they use to get through what is honestly a very difficult career. Medicine is hard. Being a surgeon is really hard. We already hear all the rough statistics about the use of these substances, about mental health issues, suicide, etc. That I think sometimes the starting point can also be a physical injury for some of these folks. So I want to call it out because I think it's important that we at least acknowledge that that's always a possibility for people.
Yeah, I think it's a huge point, Jay. And I just want to make a very vocal point too. I signed an opioid contract when I had my knee surgery for a certain amount of pills, and I was not allowed to ask for more, period. And I will tell you, in retrospect, there were some days after surgery, and honestly, my knee hurt for months. It hurt every single day. And you could imagine if you had access to pain medicines that made it feel better on a daily basis, how that could easily have turned into a habit, and that could have easily gone down the wrong path. And one of my really good basketball buddies from Baltimore, when I was in Baltimore, college basketball player, had an injury, started taking pain meds, stayed on pain meds, got into law school, was a smart guy, and things spiraled out of control after, a while. And that can really happen too. So you're right, kind of positive adaptive strategies are hugely important. And I hope that's what we're giving people examples of today is positive ways to kind of work through some of these physical ailments. Angie?
Yeah, I was just going to also add, I agree with everything that you said, Jay. I think it was such an important point. And I want to really emphasize what you said embedded within it is that when you see it, you have some power and some agency that you can say something. It is uncomfortable, yes, but it can be incredibly important. And I was thinking the example I was saying, that person ended up addicted to opioids, as a matter of fact. Also, he was stuck in that, and that was his story as well. And we're all coaches in some form or another, right? We coach. And so you're the way you spoke is a very coaching mindset. And I found a question to ask, because I think it's hard to make that, how do you actually bring it up? And I found one really effective way of saying it is that everything we do has a purpose. Like, it might be maladaptive, but it's giving us something. What is it, right? What is it? And so the victim mentality, the question is, what is that giving you? But also, what is it taking away from your life? And allowing someone to actually verbalize, like, it is giving me this. And then it's also taking away X. We often don't see what it's taking away. We only feel what it's giving to us. That's why we continue in it for a long time. But being able to be a shine a light for that person by asking them that question out loud, that may be all it takes. And maybe it just plants a seed, but don't discount what effect it might have on somebody who's suffering in that way.
Powerful, powerful stuff. And this has been an incredible conversation. We're getting close to the end of our time. So I just want to give both of you the opportunity. Jay, we'll let you go first. Is there anything we missed? What else, is there anything else you wanted to talk about or bring up that you think is important for people to hear before we sign off about physical health and well-being and recovering from an injury?
Yeah, the only thing I will say that I guess there's a couple things we haven't said, but I'll keep them brief. One, I would obviously never wish an ACL rupture on anybody or a hip injury on anyone. And knowing that you each have had these things honestly makes me feel a little bit less abnormal, makes me feel a little bit more normal, makes me feel like, okay, this is just a part of life. And that, other people have these same things and they can still be super complicated. Because I respect you both deeply. I love spending time with you. I admire you. To know that people that I respect and admire have these things makes me feel like, okay, it's also possible for me to live with this and be respected and admired, because we all have that need to be respected, admired a little bit. So that's for me, that's a reassuring thought. And I think for our listeners, I would just say, everyone goes through this on some level. Or it may not be a hip, it may not be a knee, it may not be a thumb, it may not be your eyes, but life is hard for everybody. And the trick isn't just to avoid the hard things. The trick is to show that you can work through them. And it's still possible to be happy. Like, it doesn't necessarily have to be doesn't have to be a sad thing that you had an injury. Of course, it limits us from doing various things. But to Angie's point, it may free us up to do other things that we had never even thought that we could do. So as weird as it sounds, I'm enjoying being in the space that I'm in. I look forward to my physical therapy appointments right now because I want to see how I'm progressing. I want to see how that dynamometer is registering. Have I gotten better or not, etc. It's actually a fun game. I'm enjoying having leveled up to this point and seeing how I can find joy in all of this. Because that's the whole point of life. Find joy.
Awesome. Angie?
Yeah, I'll just say one other thing that I think very much aligns with what you just said, Jay, and that is sometimes it's hard to be in that space. Like, you're in that headspace where, you can see the possibility. But what if you're listening and you're like, I don't see it? Like, what are these people talking about? Well, go talk to somebody. That's really the truth of it. I mean, yes, it takes some vulnerability to do that, but you've heard already 3 people who've had injuries. I mean, injuries are a part of life. So go talk to someone and just see what talking to somebody might uncover for you. Because, that's why coaching is helpful. Mentorship is helpful. All of these things. Therapy is helpful. All of these things are helpful because it gives you an outlet to get it out of your head and into a space that allows you to use logic in the next step. So if you are listening to this and you're like, all of this, like, I'm not going to swear on this podcast, but all of this, what we're talking about that just, it doesn't resonate with you. Well, then take a first step and just talk to some people, because that may unlock what is not possible to do on your own. And that's sometimes the case. I think that was the case for me years ago. And then once I was unlocked, I can do it for myself now. But sometimes you need help. So don't discount that too.
And if you have no one to talk to, you can talk to me. My email is Angie_Smith@med.
That is not the correct email address, Jay.
I did that on purpose. I didn't want to give out your real address.
Smith somewhere in the world is going to get a lot of email.
Don't worry,
I'll
put your real email address in the podcast notes. It'll be fine. No, it's a great point. And I was just going to say, when we initially started talking about doing this podcast, I was not in a great headspace. And that's why I kind of called you guys and said, hey, listen, I'm in a bad headspace right now. Let's work through this together. And it took us a couple months to kind of coordinate this. So I'm in a much better headspace now, but that's part of this process. And it didn't happen overnight for any of us to be in a good headspace and to evolve through this. So I think that's also very fair to say you will be in a bad headspace and embrace it. And I think that's part of what we've talked about today. Well, good. I'm going to summarize then, just because this has been a phenomenal hour and change. I can't wait to see you guys in person and kind of continue this conversation off the air, because it's been a ton of fun. But just to kind of hit on some of the key concepts, I think first and foremost, what we talked about is normalizing these conversations. These are should be standard conversations for surgeons. We all go through this. Doesn't matter what your physical activity level is, doesn't matter what you're doing. You're going to struggle with your physical health at some point in your life, if not multiple points. So talk about it. Talk about it with colleagues, talk about it with friends, and seek people out if you're not in a good headspace. Part of it we talked about too was processing this. Angie talked about grief. I talked about embarrassment. Jay talked about metabolizing this process and this problem. And I think that's part of it, is thinking about who you are. And we spent a bulk of our time in one way or another talking about identity and how we refuse to let kind of the injury create our identity, but it becomes part of our identity. And our physical well-being is certainly part of that. And in a variety of terms, we talked about evolution, maintaining good physical health and physical well-being to sustain a long career, but recognizing that where we were 10 years ago is not where we are today, is not where we're going to be 10 years from now, and taking that all into account. So I want to thank everybody from listening. I want to thank my esteemed guests and friends, Angie Smith, Jay Shah. So much fun having you guys always, and look forward to talking to you again.
Thanks, Phil.
This was awesome, Phil. Thanks for getting us together.